This is a 5-hour NCLEX 2025 crash course packed with over 100 high-yield practice questions, detailed explanations, and must-know nursing interventions. Struggling to remember drug interactions, side effects, or nursing considerations? Not sure how to eliminate wrong answers under pressure? Failed NCLEX before and scared of repeating the same mistakes? Don't worry. By the end of this video, you'll have the confidence and strategies to tackle even the toughest NCLEX questions. Powerful test-taking strategies to help you pass with confidence. Are you ready? Set your timer, grab a notebook, and let's get started.
These are one of the earliest antibiotics discovered and also very popular in use. So how can you identify these antibiotics? Look for the ending -cilin at the end. Examples are amoxicillin, ampicillin, carbonicillin, nafcillin, oxacillin, dicloxacillin, piperacillin, etc. Let's study about the side effects and nursing considerations to alleviate those side effects of penicillin one by one. The primary concern with penicillins that are orally administered is the GI disturbance, so most penicillins taken orally are advised to be taken with food and not in the empty stomach. The other concern is the allergic or the hypersensitivity reactions, which presents with rashes and anaphylaxis. Anaphylaxis means severe and potentially life-threatening allergic reaction. Any antibiotics must be given in full dose or full regimen so that its effect is met and there is decrease in drug resistance. Keep in mind that these drugs are excreted renally, so concomitant use of other drugs may increase or decrease the renal expression. Also, if there is any renal disease, the drug expression is reduced. So, can a pregnant woman take penicillin? It is advised not to take penicillin because it can affect the development of infant or can cause superinfections. Also, there are chances of superinfections, so any signs of superinfections should be monitored closely. Superinfections simply are the infection following a previous infection, especially when caused by microorganisms that are resistant or have become resistant to the antibiotics used earlier. Question 1. Here, it's a question on safe administration of penicillin. This is a select all that applies type of question. I will give you some time to go through the question and options. Please pause the video and write your answer in the comment section. I want to see who scores all correct in the comments. A 35-year-old patient is prescribed amoxicillin for a bacterial infection. Which of the following are important nursing considerations when administering penicillin-based antibiotics? The options given to you are: Option A, always administer on an empty stomach for optimal absorption. Option B, monitor for GI disturbances and advise taking the medication with food. Option C, encourage the patient to stop the full regimen once symptoms improve. Option D, be cautious in patients with renal disease as it may affect excretion. Option E, penicillin use is safe during pregnancy without any potential risks. Option F, watch for signs of superinfections following treatment. All right. Very similar with penicillins are antibiotic group called cephalosporins. To identify cephalosporins, look for this unit CEF at the beginning of every drug name. Example: cefazolin, cefotaxime, cefalexin, cefdinir, cefaclor, cefiroxil, etc. The side effects and nursing consideration in administration of these class of antibiotics is very similar to penicillins. These drugs can have cross-reaction with other cephalosporins and penicillin drugs, so care should be taken for this point too. So, as we studied in penicillin, these cause GI disturbances, so should be taken with food. Care should be taken so that superinfections are reduced. There is chance of hypersensitivity or allergic reactions. These drugs too are excreted renally and are nephrotoxic in patients who have predisposing renal insufficiency. And these drugs should be used with caution with pregnant and lactating mothers. A 42-year-old patient has been prescribed cephalexin for a bacterial infection and reports mild GI disturbance after the first dose. The nurse should prioritize. You should select among the options here to ensure patient safety. A. Advising the patient to take the medication with food to reduce GI upset. B. Assessing the patient for signs of a severe allergic reaction, such as anaphylaxis. C. Encouraging the patient to take the medication on an empty stomach for better absorption. D. Informing the patient to stop the medication if the GI symptoms worsen. E. Reminding the patient to finish the entire course of antibiotics even if symptoms improve. Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything, clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN questions and answers practice guide. It's a take-in for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic examples. The next popular class of antibiotics is the tetracycline. Quite easy to identify, the drugs of this class comes with the ending cycline. Let's study some main points from drugs of this class. First important point, drugs of this class stain the teeth. Drugs of this class can also damage the bone. They are quite common for pill-induced esophagitis, so patients must be advised to stay upright after ingestion of this drug. These drugs can cause photosensitivity reaction, so you should advise patients for walking with some protective clothes and creams. They can also cause hypersensitivity reactions. They also can form complex with milk. Avoid milk with tetracycline. As with all other antibiotics, they are GI intolerants, but these drugs shouldn't be given with food. So these are the points you should be memorizing for preparation of your NCLEX examination. I hope it was easy as usual. Here, it's a question on nursing considerations for tetracycline administration. This is a select all that applies type of question. I will give you some time to go through the question and options. Please pause the video and write your answer in the comment section. I want to see who scores all correct in the comments. I will provide you the hints after the timer is over. A 28-year-old patient is prescribed doxycycline for an infection and is advised to take the medication while staying upright to avoid esophagitis. Which of the following are important nursing considerations when administering tetracycline antibiotics? Option A, advise patients to take the medication with milk to prevent GI intolerance. Option B, monitor for potential photosensitivity and advise sun protection. Option C, tetracyclines can be safely taken with food to reduce GI side effects. Option D, advise patients to stay upright after taking the medication to prevent esophagitis. Option E, these drugs are safe to take during pregnancy without any risks. Option F, warn patients that tetracyclines may stain teeth and damage bones, especially in children. The next group of antibiotics are macrolides and usually end with thromycin or mycin at the end. Examples are erythromycin, clarithromycin, azithromycin, and thromycin. These are very common antibiotics today. But please do not get carried away with the thinking that all drugs ending with mycin are macrolides. We also studied that drugs of aminoglycoside group, such as gentamicin, Vancomycin or neomycin also end with the ending mycin. Watch out for thromycin ending. Let's now see some of the main points for the drugs of this class. Like penicillins and cephalosporin and other antibiotics, they can cause GI effects. They can cause superinfections. They are hepatotoxic. Monitor liver function tests. On ECG strip, they can cause prolonged QT elongation and may ultimately lead to cardiac death. Macrolide can increase drug levels of certain anticoagulants such as warfarin, carbamazepine, and theophylline. So it is advised that patients already in these drugs should not be given macrolides.
Here, it's a question on nursing considerations for macrolide administration. This is a select all that applies type of question. I will give you some time to go through the question and options. Please pause the video and write your answer in the comment section. I want to see who scores all correct in the comments. I will provide you the hints after the timer is over. A 60-year-old patient is prescribed clarithromycin for an infection. The nurse educates the patient about potential GI effects, the risk of hepatotoxicity, and the importance of regular liver function monitoring during treatment. The nurse also advises the patient on the risk of prolonged QT interval and the need to avoid taking the medication with warfarin. Which of the following are important nursing considerations when administering macrolide antibiotics? Option A, macrolides should be given with food to prevent GI intolerance. Option B, monitor liver function tests due to the risk of hepatotoxicity. Option C, macrolides have no effect on the heart and do not cause any changes in ECG. Option D, be cautious when giving macrolides to patients on anticoagulants like warfarin due to potential drug interactions. Option E, prolonged QT interval on ECG is not a concern with macrolides. Option F, macrolides are safe to use during pregnancy with no risks to the fetus.
One of the drugs that is widely taken for the exam for its important side effect, that is bone marrow depression, are fluoroquinolones. So how can we identify these classes of antibiotics? It's quite simple. Look for the ending with -acin. Examples are gadafloxacin, ciprofloxacin, iprofloxacin, gemafloxacin, levofloxacin, moxifloxacin, and ofloxacin, etc. Let's see some of the main important points for administering drugs of this class. As we said earlier, there is an adverse effect called thrombocytopenia, which is a bone marrow depression with fluoroquinolones. There can be immediate drop in the blood pressure, especially if they are given on an IV line, so keep this point in mind. Although there is GI effect as with other antibiotics, remember, fluoroquinolone cannot be taken with food. For quick memory, remember the mnemonic FLUMAT, that is fluoroquinolone, macrolides, and tetracyclines are the antibiotics that cannot be given with the food. Also note there is photosensitivity reactions with this drug. So patient must be advised not to walk under the sun. Other symptoms are quite common for every patient, such as dizziness, headaches, insomnia, depression, etc. With this we have covered some important points from fluoroquinolone class of antibiotics. Remember, all the points are common for all the drugs of this group.
Here, it's a question on nursing considerations for fluoroquinolone administration. This is a select all that applies type of question. I will give you some time to go through the question and options. Please pause the video and write your answer in the comment section. I want to see who scores all correct in the comments. I will provide you the hints after the timer is over. A 50-year-old patient is prescribed ciprofloxacin for a bacterial infection. The nurse educates the patient about the importance of taking the medication on an empty stomach, avoiding sunlight due to photosensitivity, and being aware of potential side effects such as dizziness and headache. Which of the following is an important nursing consideration when administering fluoroquinolone antibiotics? Option A, fluoroquinolones can be safely taken with food to reduce GI effects. Option B, fluoroquinolones may cause immediate drop in blood pressure, especially when administered via IV. Option C, there is no need to advise patients about photosensitivity or sun exposure. Option D, fluoroquinolones can be safely taken with dairy products to reduce GI discomfort. Option E, fluoroquinolones are not associated with any side effects like dizziness or insomnia. Option F, it is important to monitor for thrombocytopenia, bone marrow depression. All right, let's see the hints to solve this question. For each of the following nursing considerations when administering sulfonamides, indicate whether it is a true or false statement. You basically have to tick whether the statements are true or false. Don't worry, I will come up with hints and explanations after the timer is up. Please write the answers in comment section. I am really excited to see who scores all the questions correct in this practice test.
Like fluoroquinolone, the other class of drug that can cause thrombocytopenia or bone marrow depression are the sulfonamides. Common points, as we have already discussed, they may cause bone marrow depression. This is also called thrombocytopenia. These classes of drugs are both nephrotoxin and hepatotoxic. So we should access the liver function tests and kidney function through BUN, creatinine, and urine output levels. We should watch out for rashes or any photosensitive reaction. They can cause photosensitive reaction. The patients must be informed to walk under the sun with care. Patients must be advised to use sunscreen and protective clothing with sun exposure. They can cause birth defects, so shouldn't used in pregnancy and lactation. There can be cross-sensitivity and allergic reaction with drugs of this class and with other antibiotics. So these are some very important points to be remembered for sulfonamides for your NCLEX examination. I hope this was easy. So what are diuretics? They are also called water pills and help get rid your body from salt or sodium, which can cause hyponatremia as a side effect and water. Most of these medicines help your kidneys release more sodium into your urine. This is the reason diuretics are used in hypertension. Basically, as other antihypertensives are contraindicated in pregnancy, we use these water pills in pregnancy-induced and related hypertension. We will basically study 4 classes of diuretics in this session: loop diuretics, thiazide diuretics, potassium-sparing diuretics, and osmotic diuretics. Note that loop diuretics are more commonly used and are more efficient than other diuretics. Before going in depth for each of these drug classification, please remember some common points, which is true for all diuretics, and these are quite useful for NCLEX examination too. All diuretics help in throwing out sodium and water, so basically in toxic doses, all diuretics causes dehydration. All diuretics can induce digoxin toxicity with the exception of potassium-sparing diuretics. All diuretics are contraindicated in patients with lithium, and this can cause lithium toxicity.
Hey, if you're looking for a solid resource to practice questions and answers as you get ready for the NCLEX, I've got a recommendation that might really help you out. I recently found the Next Gen NCLEX RN Practice Question Bank, Big Book of Question Answer Practice, and it was super helpful for preparation of this video as well. If you're trying to get comfortable with the new next generation NCLEX format, this book is definitely worth checking out. It's got daily practice questions that are designed to reflect what you'll see on the exam, which is awesome because it gets you into the right mindset. Plus, after each question, you get detailed explanations so you'll not only know the right answer but understand why it's right and why the other options are wrong. That really helps you build your critical thinking, which is key for the NCLEX. I also love that it includes study tips and strategies specifically tailored for the NGN format. And if you're like me and need a little motivation, it has success stories and insights from other nurses, which really keep you inspired throughout your prep. If you're looking to practice and build confidence, this could be a great resource to add to your study routine. It's structured so you can stay on track and focus on mastering the material step by step. Just thought I'd share in case you're looking for something to really help with those practice questions.
So first let's start with loop diuretics. You can identify loop diuretics with the ending IDE. These are called loop diuretics because these work on the loop of Henle in the nephron. They inhibit the sodium and chloride reabsorption from nephron and thus impart their diuretic effect, but please keep in mind that they can alter the reabsorption of all electrolyte, so you should watch carefully the electrolyte concentration for all diuretics, basically the magnesium, BUN, creatinine, and uric acid level. As a side effect of loop diuretic, such as furosemide, you may observe side effects such as ototoxicity and can result in deafness, so you should watch out for administration rate of furosemide or other loop diuretics. It should be infused slowly on IV, as it can decreases the electrolyte reabsorption. There could be hypomagnesemia, hypokalemia, hyponatremia, etc. Also remember a term thrombocytopenia, in which there is a low platelet count, which is also a side effect of loop diuretics. Besides these, let's see some common side effects quite common for all types of diuretics that we talked at the beginning of these chapter. Like all other diuretics, in toxic dose, it may cause dehydration. They can induce digoxin toxicity and are contraindicated in patients with lithium.
Diuretics introduction and loop diuretics. For each statement below about diuretics, particularly loop diuretics, mark whether it is true or false.
Another diuretic class is potassium-sparing diuretics. That is, they help in potassium retention and promote sodium and water excretion. The main drug for drugs of this class is spironolactone. Watch out for the NONE for drugs of this class, spironolactone and eplerenone, etc. Other drugs are triamterene and amiloride. So what could be the possible side effect of drugs of this class? As we studied, it helps to retain potassium, so one common side effect could be hyperkalemia, which manifests in forms of nausea, vomiting, weakness, diarrhea, rash, etc. So what suggestion as nurse would you give to someone with potassium-sparing diuretics? You should tell him or her to avoid salty foods because they may contain potassium. Green leafy vegetables such as spinach and banana is better to avoid. Also, as in severe kidney and hepatic conditions, the drug should be avoided. They can also cause digoxin toxicity, dehydration, and are contraindicated in patients undergoing lithium therapy.
Potassium-sparing diuretics. A 58-year-old patient with heart failure is prescribed spironolactone, a potassium-sparing diuretic, to help manage fluid retention. The nurse notes the patient's potassium levels are slightly elevated and the patient has been consuming large quantities of bananas and spinach daily. Which of the following should be emphasized in the nursing education for this patient regarding potassium-sparing diuretics? Option A, it is important to increase the intake of potassium-rich foods like bananas and spinach. Option B, patients should avoid foods that are high in potassium to prevent hyperkalemia. Option C, potassium-sparing diuretics are safe for patients with severe liver and kidney disease. Option D, potassium-sparing diuretics can lead to dehydration, especially in patients on lithium therapy. Option E, spironolactone, is best taken with salty foods to help balance potassium levels. Option F, It is safe to take spironolactone with other potassium-sparing diuretics without concern.
After this, let's walk through another class of diuretics called thiazide diuretics. Like the name, drugs of this class of diuretics usually end with thiazide. Examples are hydrochlorothiazide, chlorothiazide, etc. They help in increasing the sodium and water excretion. As they throw out the electrolytes or excrete electrolytes, they may cause hyponatremia, hypokalemia, and, as water is also thrown out, may cause hypotension due to hypovolemia and electrolyte imbalance. Note one very important side effect of diuretics of this class. They can cause hyperglycemia. Hyperglycemia means high blood glucose or blood sugar. As nursing interventions necessary to keep in mind for your NCLEX examination, remember, you should check the blood sugar of patients regularly and change positions slowly to prevent orthostatic hypotension. Also, as far as possible, this and all diuretic classes of drugs should better be taken in morning as they may cause sleep interruption as they increase the urine frequency. So, what if patient need immediate diuresis? For example, in some toxicity conditions, can we still use the thiazide diuresis? Your answer should be no. We should use loop diuretics in that case for immediate diuresis. Also keep these main 3 points in mind when talking about thiazide diuretics. They can cause digoxin toxicity, dehydration, and are contraindicated in patients undergoing lithium therapy.
Thiazide diuretics. What is a common side effect of thiazide diuretics? Option A, hyperkalemia. Option B, hyponatremia. Option C, hypercalcemia. Option D, hypoglycemia. Option E, increased urination. Option F, weight gain.
The next class of diuretics are the osmotic diuretics. A common examples are mannitol and isosorbide. Unlike other classes of diuretics, it is basically used to decrease the intraocular pressure. Keep a note to this point. Another important point, they are usually used with chemo to induce diuresis. So why are drugs of this class called osmotic diuretics? Because they increase the osmolarity of blood and renal filtrate. As side effects, mannitol and isosorbide can cause fluid and electrolyte imbalance as with all other diuretics and can cause hyponatremia. Also, like other diuretics, they can cause digoxin toxicity, dehydration, and are contraindicated in patients undergoing lithium therapy.
Osmotic diuretic. For each statement below about osmotic diuretics, mark whether it is true or false.
Unlike for other drugs that have common ending, there are many drugs in this class, so we will have to learn the main drug properties for your NCLEX examination. These are antipyretic, meaning they reduce the temperature and hence basically used in fever. Anti-inflammatory, as they reduce the inflammation and hence used in various inflammatory conditions like rheumatoid arthritis. So, let's see some common examples of NSAIDs. We have aspirin, ibuprofen, naproxen, ketorolac, indomethacin, diclofenac, aceclofenac, phenoprofen, ketoprofen, etc. Remember, paracetamol is usually called acetaminophen in US, so please keep in mind that whenever you are asked about acetaminophen, remember, it is NSAIDs and paracetamol. Also, you see here two confusing NSAIDs, ketorolac and ketoprofen. Ketorolac is used for short-term management of moderately severe acute pain that otherwise would require narcotics. Ketoprofen is used for the management of the signs and symptoms of rheumatoid arthritis, osteoarthritis, and primary dysmenorrhea or menstrual cramps. So, what are NSAIDs used for? Remember this. They aid in pain and inflammation reduction. As discussed already, it is anti-inflammatory. It is given for patients with rheumatoid arthritis. But please remember, NSAIDs does not cure arthritis at all. It just eases the pain of patient and reduces the inflammation. Remember the term pain whenever you hear of NSAIDs. Having said that, these drugs shouldn't be given in patients with asthma because it can exacerbate the condition. Whenever it is prescribed, doctor prescribes you to take NSAIDs along with foods so that it can prevent you from gastrointestinal upset. Also, notice this point. There is a GI bleeding prevalence with these drugs. Take well care of this point. If a patient is already on anticoagulants whose chance of bleeding is very high and at the same time you give NSAIDs to that patient, the result could exacerbate the bleeding. So remember, if you are giving drugs like warfarin or heparin, make sure not to give any NSAIDs at the same time. One very important point to be taken in consideration for your NCLEX examination is the drug interaction with lithium. Lithium is basically used for people with bipolar disorders. NSAIDs is contraindicated to in patients taking lithium. This is because lithium is cleared renally. NSAIDs decreases the renal blood flow, so it can cause lithium toxicity. The characteristics of lithium toxicity are confusion, ataxia, agitation, neuromuscular excitability, polyuria, and polydipsia. This can be most common and important drug interaction with lithium, so please keep this point in mind. After lithium and nephrotoxicity, also remember that NSAIDs are also hepatotoxic. There could be chances of severe hepatotoxicity with NSAIDs, basically with paracetamol. Remember that you won't get any question with paracetamol because this is called acetaminophen in US. In rest parts of the world, basically acetaminophen is popular as paracetamol. Another important point for your NCLEX preparation is sodium retention, which causes hypertension. Prolonged hypertension can result in congestive heart failure, so make sure you do not give NSAIDs for people with CHF and hypertension. We learned in lithium toxicity with NSAIDs that NSAIDs are nephrotoxic, so people with renal failure or disorder should avoid taking any NSAIDs. Let's see some main important drug-drug interaction with NSAIDs. We will learn these in the respective drugs lessons too, but keep a note on these points. With beta blockers, there is a decreased antihypertensive effect. Remember the LOL drugs are beta blockers, such as atenolol, propanolol, etc., and these are given in hypertension. Concomitant use of NSAIDs with these drugs decrease the hypertensive effect. Also, remember it decreases the diuretic effect of loop diuretics.
Let's jump in and start practicing. A 50-year-old patient with rheumatoid arthritis is prescribed ibuprofen for pain and inflammation relief. The nurse advises the patient to take the medication with food to avoid gastrointestinal upset and to monitor for any signs of bleeding. Which of the following is an important nursing consideration when administering NSAIDs? Option A, NSAIDs can be safely used in patients with asthma without any issues. Option B, NSAIDs should be taken with food to reduce the risk of gastrointestinal upset. Option C, NSAIDs should be prescribed alongside anticoagulants to prevent clotting. Option D, NSAIDs do not cause any drug interactions with lithium. Option E, NSAIDs are safe to use in patients with renal failure. Option F, NSAIDs can reduce the effects of diuretics and beta blockers. Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything, clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and most importantly, help you feel more ready. Good luck. You've got this.
We know that aspirin is also NSAIDs and is a derivative of salicylic acid. Aspirin toxicity is called salicylism, which presets symptoms such as sweating, tinnitus, and headache. Besides anti-inflammatory and antipyretic effects of aspirin, it can also be used to prevent blood clot formation and hence prescribed to patients with some heart diseases and also for angina or chest pain. Also note one important point. There is chance of acute liver failure and encephalopathy seen in children who take aspirin, making them lethargic with vomiting. This is called Ray's syndrome.
For each of the following statements related to aspirin, indicate whether it is true or false. Look at the following case study. It contains history, vital signs, lab results, physician orders, and medication. Please answer the following question based on the case study. Though the case study is descriptive and contains all these information, you don't quite need all the information to answer this question. You can do it just with whatever we learned in this lecture so far.
Another class of drugs important for pain management are the opioids. Opioids are a family of drugs that are usually prescribed to relieve pain, control coughs and diarrhea, and treat addiction to other opioids. Although I talked about it being a pain-managing drug like NSAIDs, remember, it is not anti-inflammatory or antipyretic, so cannot be given to reduce the fever or in inflammatory conditions like rheumatoid arthritis, unlike NSAIDs. Whenever you think of opioids, remember opioid contains O like that in LOW. It lowers the respiration, decreases brain activity, or causes sedation and decreases the heart rate. That is, it has bradycardic effect. Remember ONE or INE at the end of some common opioids like oxycodone, hydrocodone, codeine, and morphine. Also, remember a term opioid overdose, and unlike, as I said, there is low respiratory rate with opioids in opioid toxicity, there is reverse respiratory depression, tachycardia, hypertension, tremors, and sweating. The main toxic effect is decreased respiratory rate and depth, which can progress to apnea. Other complications are pulmonary edema, which usually develops within minutes to a few hours after opioid overdose, and death result primarily from hypoxia. Pupils are miotic in opioid toxicity. So, whenever a patient is suffering from opioid toxicity, we have to administer opioid antagonists such as naloxone and naltrexone. Naloxone can reverse and block the effects of other opioids such as heroin, morphine, and oxycodone. Side effects of opioids, and mainly codeine, which is also an opioid, include constipation, so we give laxatives along with this drug. We talked that opioid cases respiratory depression and should be used widely with people with underlying COPD and elderly people, and also people who smoke too much. So this is all about the main important points on opioids that you have to remember for your NCLEX examination. Thank you. Hope you learned many things in this lecture. Opioid antagonists. Opioid antagonists are those drugs that can reverse the respiratory depression, particularly in opioid overdose. Example of opioids are codeine sulfate, hydrocodone, and codeine phosphate. Examples of opioid antagonists are naloxone and naltrexone. With these drugs, side effects are common as with other respiratory or anti-asthma drugs such as tachycardia and palpitations, hypertension, restlessness, tremor, vomiting, and sweating, etc. Note that although drugs of this class are used to treat respiratory depression, if the duration of opioids given is more than the duration of administration of these anti-opioids, they can cause respiratory depression. As these drugs can cause severe sympathetic effects, you should have all the resuscitative medical equipment and oxygen available if this drug is being given in IV. Also, note one thing, that the drugs of this class are used to treat opioid-related respiratory depression, so shouldn't be used to reverse the respiratory depression of non-opioid antitussives such as dextromethorphan and diphenhydramine. So this was all about the opioid antagonists used in respiratory conditions for treating opioid-related respiratory depression.